If you are interested in a career that helps patients and individuals with managing their chronic conditions, then working in a hospital pharmacy may be the career for you. The team at Community Healthcare System in Onaga highlights the critical roles in a hospital pharmacy.
Pharmacy is essential to the hospital because we are how medications are acquired for the whole system. So every single medication that's given to a patient in the hospital comes through your primary hospital pharmacy. I feel like I was meant to be a pharmacist. We get to focus on one thing and we can make a real difference in the quality of a patient's care by focusing on that one thing. And if you're looking at the entire picture, sometimes you miss that one thing that could actually really impact the greater picture.
A pharmacy buyer keeps account of all the medications in the hospital, and then if we need any, I purchase that for the facility. So I can buy anywhere from something as cheap as an aspirin to something that would cost the same as a car or more.
It's really busy in the pharmacy. A lot of times, you might fill 100 plus prescriptions a day. And so usually you have a lot going on, and that's kind of, it fits my personality well to stay busy and to help people. It's very detail oriented. So you really got to fill everything exactly. So it's kind of like almost following a recipe. Like I like to bake, I like to cook. So you follow these steps and you get this outcome. And I feel like that was something that I really thrived in that environment.
As a pharmacy buyer, you either have to be a nurse. Critical access hospitals can hire nurses to be buyers, or you can take a program called Pharm Tech, and a pharmacy technician can also be trained in buying and helping the pharmacist.
In high school or right out of high school, you can certainly be a pharmacy clerk, but it'd probably be a good idea to go ahead and take the test and complete the certification to be a certified pharmacy technician. And then you could kind of see if you like that and there's a career there, then you could also see if that's something that you really like, if you want to go on to get your undergraduate degree or your Doctor of Pharmacy degree. To be a pharmacist, you have to now complete the Doctor of Pharmacy program at a certified location.
I don't necessarily do direct patient care anymore, but I still help people by trying to find the lowest cost of any medication for them. It's kind of like ultra shopping in a way. It kind of feels that, but it also is, I know I'm helping other people by making sure they have the medications they need.
As a pharmacy technician, they're actually expanding what they can do in many states, including Kansas. And so pharmacy technicians can immunize. You have to complete the requirements for these things, but it's becoming even more exciting to be a pharmacy technician because there's so much more that you can do in the pharmacy than even whenever I was in a retail pharmacy. So that's expanded in just the last few years. The other thing is if you're a pharmacy technician, there's lots of different spaces that you can operate. And so being in a hospital, it's different than what it looks like in a community-based pharmacy. So you can be a pharmacy buyer, you can deal with a lot of automation, you can talk to patients and get med histories on them. So really there's lots of different things that you can do with that license, even if it's not your traditional, what you think of when you see the pharmacy technician at your local pharmacy.
As a pharmacy buyer, some things that you need to have an interest in is organizational skills, some math, pretty simple math. I always tell people, yeah, I get to do kindergarten math. I can count to 10 or 20 or 100, but you count a lot in pharmacy. Process improvement, or what is the quickest way I can do this? Lots of things like that happen in pharmacy because you want to keep your costs down. So how best can I keep my costs down? How effective can I make things? So if you're interested in that kind of thing, pharmacy is good for that.
If you think you might be interested in going into healthcare because you think health and health care is interesting just in general, pharmacy is a great way to go because you're on the healthcare team. You get to look at labs and you get to see the medications and the different disease states. It's a lot of behind the scenes work. Sometimes you're the unsung hero. So if that is something that appeals to you and you like doing things just so, then a career in pharmacy might be a good choice for you.
If you're thinking about looking into pharmacy, I would reach out to your local pharmacist. I would go spend a day with them. Just check it out, see what it's about. It appeals to lots of different aspects. If you're strong in science, it appeals that way because it can go down to the molecular level. It's strong in math because you do math all the time with dosage calculations and stuff like that. So if you like math, that's good. It's strong in organizational skills because you have to be organized in the pharmacy to know what you need and what you need to get in. Kind of has a very broad appeal. And honestly, if I was a high school kid, I really wish somebody would have just even said something about it because I think it would have sparked my interest.
I love my job. I can't imagine doing anything else. Being in particularly the hospital pharmacy, I think is what I was meant to do.
I want to welcome our panel from the hospital pharmacy at Community Healthcare in Onaga to help answer questions about career opportunities in pharmacy. Joining us this morning from Community Healthcare System in Onaga is Haley Brown and Ann Stahlbaumer. Good morning.
Good
Good
morning.
morning.
Your video is great. I think I should go back to school. I'm excited to ask you guys some questions so all of the folks on the call can learn more about this career. But can you each tell us both what you enjoy most about your career? Like, what would you say is the most rewarding part of your job? Let's start with Haley.
I would say definitely getting to work so closely with the providers and the nurses because you focus on the one thing. So they have so much going on, and I get to focus on the medication. So we're part of the healthcare team, and I work with them and I make interventions, and then you kind of build your trust and your rapport with the people that you work with. And then to have them call you and ask for your advice and ask for your opinion on medication orders, it's really rewarding. It just you help patients, but you're helping your providers, you're part of the team, and that's my favorite part.
And Anne?
I would echo what Haley said. I think part of it, the most rewarding thing is I still help patients. I might not do direct patient care or be at the bedside, but I'm still helping somebody.
Okay, I have another question. Before we get to all the questions in the chat, I do have a question about new things coming down the pipeline. What are some of the new innovations in the pharmaceutical field that is making a difference maybe for patients right now? Or what are some of the things you're looking forward to in the future that you understand are coming your way?
Well, I would say if you like innovation and change, then pharmacy is an excellent place to start because the pharmaceutical industry is ever changing. So there's always new medications that come out. And the pharmacist's job is really to assess those therapies and see what value there is for your patients and what value there is. You need to educate your providers on that the value that there is for the patients. So there's a lot of different things to get into. Any one thing would be kind of difficult, but I if you like to have an industry that you always have to stay on top of, then pharmacy is for you.
And
And
what
I
about
would
you, Anne? Yeah.
I would say just the technology that goes along with safety and efficacy. In pharmacy, you deal a lot with safety issues and efficacy issues, and the automation that comes from automated dispensing machines has it just kind of kicks it up a level. For safety and patient care and making sure the patient gets the right medication.
Great. Well, I am going to ask my colleague Jaren at KHA to join us and let us know what kind of questions students have in the chat. Jaren?
Yeah, thank you, Cindy. Why don't we first start off with a question? Again, kind of clarifying pharmacy and pharmacy technician. We have you both here today with those backgrounds. And so, How do they work together? What's the difference in education in terms of maybe length of years? I know the video slightly touched on it again, but if you'd like to just re-summarize that, how long does it maybe take to become a pharmacy technician, and then how long does it take to become a pharmacist? And why don't we start with you?
A pharmacy technician program um, is fairly quick. It can be, I think it's just a couple months, depending on what program you choose to follow. It could be like a 2-year program, depending on the length of training you want and the depth of training you want. And a pharmacy tech cannot work without a pharmacist. And so my job is obsolete unless I have a pharmacist with me.
So, for to be a pharmacist, you have to have a minimum of 6 years of education. Probably most common is 8. Um, but yes, so the pharmacist is the one responsible for the pharmacy. So, in a community setting, you can't even open a pharmacy without the pharmacist being present. So nobody's allowed to be in the pharmacy without the pharmacist there. So they are the responsible party for all things in the pharmacy. But you rely so closely on your. I call Ann my right hand gal. I couldn't do it without her. So you have a cohesive team and you work really closely together.
Well, and another question we've gotten is, what does your shift look like? What hours of the day? Is it more of the typical office hours, or are there times when maybe, the pharmacists, pharmacy technicians, pharmacy buyers are needing to work night shifts, weekends? Could you share both at Onega what that might look like, and if you're familiar, maybe what that could take the shape of at other hospitals or other pharmacy-based organizations? And Haley, if you'd want to kick that off.
Yeah, sure. So I'm the only pharmacist in Onaga. So I would have to work 24 hours a day in order to be here all the time. And that's not feasible. And everybody knows that. So I typically I'm a morning person, and your first med pass is right around 9 o'clock usually. So I like to come at 7 so that I can be prepared for any new orders that come in. I can check patients' labs, make sure that things are going to be safe for my patients that day. So I come at 7, and I usually work from 7 to 3:30. I do like to have one longer day where I'm here till 5, just so that I can catch more people that way. But so that's kind of how we have it set up at Onega. And then we also have remote pharmacy services. So there's a whole lot of opportunities within pharmacy. So some people are verifying orders from their computer at home. Some people are verifying orders in like an office building setting, but the pharmacy is not there. So remote pharmacy services is something that is pretty common, especially in your smaller hospitals, just because they don't have all of the pharmacists available to staff everywhere. In your larger systems, though, they definitely have day shift and night shift, to where you could be working night shift depending on how large of a system that you work for.
And anything else on that, or ditto?
The pharmacy buyer for our system is pretty much a 7:30 to 4 job every day, except the weekends. I have my weekends off, which is really nice. And I walk in every day and I know pretty much what I'm going to do. I check the fill, make sure patients have enough medication on the floor to get through the next day. And then I check charges, and then I buy anything that we would need to buy. And then I also reconcile everything to make sure the tallies match up.
And in a hospital, drug diversion, opioid diversion is a really big deal. So another thing that Ann does is like our kind of auditing to make sure that if this was pulled, then this was given, and that everything kind of lines up from like a compliance and security, drug security standpoint too.
Well, and that's actually kind of one of the next questions we've gotten into the chat. And so maybe, Anne, if you'd like to elaborate, what does that look like from both of your perspectives on, ensuring that medications are safely distributed, bought, purchased, handled, managed from the get-go? I don't know, Anne, if you want to take the first stab at some of that, and Haley, if you have anything else to add, but Anne, we might start with you.
The safety, the way we keep it safe in our pharmacy is, we're in a barcode world. So if you look on the back of any package, bottle of pop, you're going to find a barcode, and it has a set of numbers with it. And that's how we do a lot of things in the pharmacy. I pull off the shelf, and that's how I order by that barcode. And you pull it off the shelf. I have another person check me, make sure I pulled the right thing that said that's what I needed to pull, and then we scan it into the computer or the automated system. And then the nurse, when she goes to give the medication, has to scan it again to make sure that's the right medication for the patient. And then it trickles back to me when I do the verification, and that, oh, she pulled that, she gave that, yep, we're all checked out good. And if there's ever a discrepancy, then Haley gets involved and upper management gets involved where, okay, you said you gave the medicine, it wasn't given, what the heck happened?
So it sounds like there's quite a bit of oversight, which is
Yeah,
to be
yep,
expected.
100%.
Right. Well, and Haley, you had mentioned a little bit ago with all the changes in medications available and how that's developing. Um, do you have to have, continuing education or other learning ongoing to stay on top of all of the new developments, new medications, new trainings? What does that look like for most pharmacists?
So to be licensed in Kansas, you have to have 30 hours of continuing education every 2 years. So that's kind of your base requirement. I am board certified in pharmacotherapy, so I have to have 120 hours every 7 years, I believe. So there is a little bit, I took it kind of to the next level of pharmacy just so that I could stay current on clinical practice. And so even within pharmacy, there's lots of opportunities to kind of expand your abilities.
Well, and here we have a couple more minutes. I want to get through a couple other questions that we've been getting in through the chat. One person is asking, how do you manage if it happens? I think folks probably assume it might happen of if somebody's a little aggravated or if there might be patients that aren't getting their prescriptions and maybe they're calling you guys. How do you work through that? Does that happen a lot? And I'll leave that to either of you if you, whichever you might want to start with that.
Well, so I would say that is one benefit of working in hospital pharmacy versus community based pharmacy. I've done them both. So you definitely get more irritated. You're public facing, so you have more people can be frustrated and the buck stops with you, so they're frustrated if the patient is frustrated, then you're going to hear about that in the community setting. In the hospital setting, the people that you get that might be frustrated with you would be your providers or your nurses, because that's who I'm working with. So if a patient's frustrated, that doesn't usually come down to me. That's the nurse that's going to get that information, and then they're going to pass that on. So luckily, I work at community healthcare system, and we've got an excellent bunch of nurses and providers, and so it's not very often that I'm getting the really irritated person just chatting with me. So that is one very strong benefit of my job, I have to say.
That's great. Well, and our last question, since we're just about at the end of this segment, and you mentioned in the video, you wish you would have been told in high school about some of these opportunities or going into that and whatnot. So, if there are, whether you're a traditional student, maybe middle high school, college age, or for that matter, even someone that's an adult learner or someone that might look for a second career, they want to make a switch at whatever point in life that they're in, is it easy if they were to want to shadow, maybe either of you or others in their community? Is it just as simple as picking up the phone and calling their local pharmacy or hospital asking for the pharmacist or others on the team? Or do you have other advice for folks if they might want to learn a little bit more on that boots on the ground in the pharmacy tech, pharmacy buyer world? And Anne, I'll start with you since you had made that comment in the video.
I think, coming from a small rural area, I stayed close to home. I think your options, I thought as a high school kid, was teaching or nursing. That shows my age a little bit, but that's kind of where my brain always went. And so it's like, oh, there's other things out there. And I was strong in other things that I didn't realize I was strong in, like the organizational skills and just attention to detail pharmacy requires. I was strong in that. And I think if I would have known that, oh, I'm kind of strong in that, and that's kind of leans towards pharmacy, I think I would have followed that a little bit more. And we're in a rural community. So, you reach out and you ask, and 9 times out of 10, people are going to say, oh, yeah, come see what I do. I don't know any of the local pharmacists, even in the community, that would tell you no. So I think you just ask. That's all you can do.
Yeah, and I'll add that there are security requirements in the pharmacy just because you do want to make sure that everybody's vetted. So, like every hospital, every pharmacy is going to kind of have different policies related to that. And so, you can call your like if somebody were to call me and ask if they could shadow, I know that they can, but the steps that happen are kind of on the HR side in our location. So they do the vetting out process and then they tell me what day they're coming to see me. So usually, it might be something I agree to, but then there's things that happen to make sure that they're allowed to be in the pharmacy, I guess.